the GI tract. It starts in your mouth and it goes all the way down, and sometimes having painful bowel movements. You can have an upset stomach. You can have heartburn. That's why you get the diarrhea. Your entire GI tract is inflamed. Heartburn can be a complaint. Certainly taste changes, a decrease in appetite. Nausea and vomiting, not that much, which is a very good thing with these medications, but sometimes it does happen. Diarrhea can be a problem. It definitely needs to be controlled. And even though diarrhea is more commonly associated with these medications, from time to time, I have patients who will tell me that they're constipated and never had diarrhea from these targeted therapies. So it's something that we need to be aware of. And again, some rectal bleeding can occur. Again, it could just be some irritation up and down the GI tract causing this. Some of the pharmacologic interventions, Imodium is a medication that's given over the counter. It's the initial drug of choice. You can give or take 4 milligrams orally at the first episode of the diarrhea, followed by 2 milligrams every 2 hours until the diarrhea subsides. And then the next medication requires a prescription, and it's a Lamodal. And we use this medication when Imodium is no longer working. We always try over-the-counter first, and Lomotil does require a prescription, a little bit stronger, and just not to exceed 8 tablets a day. I recommend that patients avoid greasy, spicy, and fried foods on these medications. Avoid caffeine and alcohol because that's just going to irritate the GI tract. And sometimes following what we call the brat diet, bananas, rice, applesauce, and toast, that can bind your system. We always encourage increased amount of daily fluid, especially when stools are loose and you're having diarrhea, because otherwise you're going to get dehydrated, and you have to keep a very careful balance of increasing your liquid intake when you're having some diarrhea. And then to increase to a soft diet slowly, and to avoid cabbage, Brussels sprouts, and broccoli, things like that, which can cause a lot of gas. The next drug is Temsirolimus, and that is a drug that's given intravenously every week. And this particular medication, my experience and from my patients, seems to be pretty well tolerated. It does have some mucositis associated with it, some fatigue, but it has a few of its own kind of particular side effects, and one of them is reactions during the IV infusion. It could be a skin rash. You could have shortness of breath, back pain, where you're really feeling short of breath, and what we call anaphylaxis, just kind of almost shock-like. It's not that common, but it can occur, and that is why it's very important that all patients always get a medication called Benadryl before the infusion of Toracel. It could also cause an increase in your blood sugar, cholesterol, triglycerides, damage to lung tissue, which is very serious, and that's why reporting a cough, shortness of breath, or a fever to your doctor or nurse practitioner is of utmost importance. And also any other infection, if you're running a fever, also report that to your healthcare team, because an increase in infections is also associated with Temsirolimus. Fatigue is a universal side effect with all these medications. Drugs like sunitinib and Nexavar seem to cause a little bit more fatigue than Temsirolimus or Afinitor and bevacizumab, but all of them will cause you to be tired. And it's just important to know that it's related to the drug and not to the cancer, that it's certainly okay to take a nap every day, because most every time my patients tell me that they took a nap, they feel refreshed afterwards and then can do an evening's activity. I've been, taking care of patients on targeted therapies for a long, long time. And the good news is that when patients complain of fatigue, over time, it does get better. So even though perhaps the first couple months of therapy can be really hard, not just with fatigue but with other side effects, know that it's going to get better. And if you do the things that we're telling you, and increasing your fluid intake and eating a balanced diet and taking good care of your skin, you will be successful in tolerating these medications. Some products for oral care. These are all over the counter. Sometimes patients like to use toothpaste that's really recommended for kids because it's not as spicy and irritating to the oral cavity, but always keeping some type of clear gloss on your lips is helpful to moisturize, and the Rinse-N-All, which can just be a soothing oral rinse when your mouth kind of has that burning feeling.